Hi, I'm Walter Medlin, surgeon and weight loss surgery patient, and I had my surgery upgraded last year because of heart disease, and I was afraid for both operations, just like you, but I have no regrets. I have several surgeon colleagues who've also had weight loss surgery, and they're friends, and they all say the same thing. They wish they had done it 10 years earlier, and so do I. It really is the most scientifically durable and effective treatment that you can have compared to almost anything else we do in general in medicine, and it really will change your life. The most common questions I hear are about money and lifestyle. Weight loss surgery averages about $1,000 to $5,000 for patients who have insurance coverage, and is rarely more than $15,000 even for those who we can't figure out any type of coverage for. But you might be surprised. Most importantly, you don't have to change into someone else in order to qualify for a procedure. Please, come as you are, we will work with you. Changes you make may not need to be as radical as you expect. Please listen carefully to the descriptions in the following video, but don't feel pressured to make a decision right now. You'll have plenty of time to have discussion and consultation with me or one of my surgeon partners in person.
It has changed the quality of life that I live now. It's totally amazing.
A life change, total life change.
I wake up every day and on my ride to work, honest to God knows, I say every day, thank you, this was so worth it.
It didn't save my life, it gave me my life back.
Welcome to Bariatric Medicine Institute, BMI. We're a dedicated team of caregivers, including surgeons, dietitian, exercise trainer, researchers, educators, hospital team, and physician assistants.
We wanted to really develop a place that provided all the care that patients needed, both before surgery to get the education they needed so they could make reasonable choices about what was the best option for them in terms of surgery, but also to provide support after surgery, because the tough work comes then when you have to make those lifestyle changes, changing the way that you eat, changing the way that you exercise. And so we've developed a multidisciplinary team in order to address those issues.
In the Intermountain West, there are many places that you can go get bariatric surgery from. However, why would you come to the Bariatric Medicine Institute here in Salt Lake? The first reason is that we're simply the best. We've done more surgery with more experienced surgeons than anyone in the Intermountain West. We've pioneered more approaches to weight loss than anyone anywhere, almost in the entire United States. We are the leading edge surgeons in the entire country, especially when it comes to the approaches using the duodenal switch and the treatment of diabetes. We have dedicated ourselves to the treatment of obesity, unlike most other programs, not only in this state, but around the country, who do part-time general surgery and part-time weight loss surgery. We're full-time weight loss surgeons, guaranteeing your excellent outcomes and publishing the results worldwide and letting people know that surgery can be done safely and efficiently in almost any locale if they just follow some of our guidelines as we set out in our numerous peer-reviewed publications.
This is a basic introduction. There is more at bmiut.com, Facebook, and our YouTube channel. There's also much more to be learned in person with the doctors in the BMI team beyond what is on the internet. Questions are welcome and expected. Our basic message for today is that excess weight can be treated. Surgery is really the only way to long-term success for most people who are more than 50 pounds overweight. The goal is to give less hunger, and that produces the weight loss.
Most patients don't realize that weight loss surgery is less risk than gallbladder surgery, and most people know someone who's had gallbladder surgery. In fact, most patients are at more risk of dying from the next 10 years from complications of obesity than having death from surgery. As a matter of fact, surgery lowers your risk of heart disease, strokes, and cancer. It reduces your rate of hip replacement, knee replacement, and abdominal hernia surgery. Weight loss surgery provides health improvements to many patients in many areas. For instance, diabetes, high blood pressure, heart attacks, strokes, sleep apnea, asthma, migraines, heartburn, and urinary leakage are all examples of medical conditions which get better with weight loss surgery. One of the biggest emphases in our own practice is that diabetes is actually curable with surgery. We have a 90% long-term cure rate with the duodenal switch out at 4 years, and with sleeve gastrectomy, it's a 25% cure rate out at 4 years.
There are really two main operations to choose from currently. The first is sleeve gastrectomy, and the second is duodenal switch. Both operations work by giving you less hunger all day long. They also give you more fullness at the end of meals, and the fullness lasts longer between meals. So the result is that food is able to be enjoyed but is less tempting, so that you're not living a life of being deprived or feeling like you're in food jail. Sleeve gastrectomy is currently our simplest tool. Most people lose between 80 and 120 pounds with sleeve, and it is, as you can see here, very simple operation that turns a football-shaped stomach into basically a banana-shaped stomach. And that portion on the outer that the blue arrow points to is actually removed. So it is a gastrectomy like hysterectomy, appendectomy, tonsillectomy. It's a removal of that tissue. So sleeve gastrectomy is also called VSG, or vertical sleeve gastrectomy, or vertical stapled gastrectomy. It is the most common operation for weight loss in the USA and in most countries around the world currently. It's very simple and it's safest overall. It has a very low risk of ulcer problems, vitamin deficiencies, adhesions, or scarring. Most people need to be checked for heartburn issues in case they have a small hiatal hernia that we can repair at the same time. And a certain number of people, as we age, will develop more reflux and have to have another operation to repair that, which is usually a 25-minute operation. It's very easy to revise a sleeve gastrectomy to either a gastric bypass or usually to a duodenal switch. We really like sleeve gastrectomy because it's very, very safe and it's effective and durable. I'm a sleeve patient because I was afraid of having a gastric bypass because of the ulcer risk and bowel kink or small bowel obstruction risk. And at that point in my life 10 years ago, we started to realize that the lap band was not durable.
The duodenal switch is the other main operation in our practice. This allows patients to lose between 100 to 300 pounds of weight loss. It offers the opportunity to take the stomach and connect it to the distal small bowel, while at the same time reducing the size of the stomach so you get full with small meals, but allowing the patient to have the malabsorption of the bypass small bowel. The duodenal switch can be thought of as two operations. The first operation is a sleeve gastrectomy, just like a normal sleeve gastrectomy, and the second operation is an intestinal bypass. We try to leave people with enough intestine so that they're able to digest their minerals and vitamins and still retain a level of hunger and satiety not present in the sleeve gastrectomy. For both the duodenal switch and the sleeve, their patients go home either the same day or the next day. Usually, duodenal switch patients stay overnight, but both of them are back to work in about a week after surgery. Here at the Bariatric Medicine Institute, we've also pioneered the use of what we call the D-loop. The D-loop is the second half of the duodenal switch. A duodenal switch is made up of two portions, the sleeve gastrectomy and the intestinal bypass. One of the most pleasing things is to take a patient who's had inadequate weight loss following a sleeve gastrectomy and do a D-loop on them. This can be done on patients at any time following the sleeve gastrectomy. It's a simple outpatient procedure which involves almost 2 to 3 days off work only, and they go home 1 to 2 hours after the operation is performed. After they get the D-loop, they lose weight for 18 months at a rate of about 4 to 6 pounds a month, and it's consistent for the 18 months. And the most interesting thing that we find is that the weight loss is very similar following a D-loop as if they had the duodenal switch as their very first operation. So it just is an additive to the sleeve gastrectomy, and it can be performed fairly simply and easily in our surgical center. There are less popular procedures both in the US and around the world that you may have heard of, which include the Roux-en-Y gastric bypass and the adjustable gastric band. The gastric bypass used to be the most popular procedure in the world and the United States. However, its numbers have been falling steadily for many, many years. After gastric bypass surgery, there's a lifelong ulcer risk with the use of NSAIDs such as aspirin, Motrin, ibuprofen, and Aleve and others, and this never goes away. No matter how long that you've had your gastric bypass, the risk always persists. There are also 3 non-surgical options that we use here at the Bariatric Medicine Institute. We have the ESG with overstitch, the Aspire Assist, also called the gastric tube, and we also have balloons, the Orbera, the Reshep, or the Obalon. All have less weight loss than either the sleeve gastrectomy or the duodenal switch, but they do often lose 20% of their excess body weight. However, we have no long-term reports for these balloons, Aspire, or the overstitch beyond approximately 1 year. We also offer patients that come to BMI weight loss medications. We have a professional program with support for patients all along the way that are using medications. There are numerous medications that we use. Some of the most popular ones that we have in our practice: Contrave, Phentermine, Saxenda, and numerous others that are too numerous to mention right here on this slide.
All surgery has risks, and duodenal switch and sleeve gastrectomy basically have the same risk as any other surgery in the abdomen. The main risk is blood clots, but people can have healing problems, and leaks are rare, and if we catch them early, very easily treated. But they will keep you in the hospital for longer. Bleeding is a risk, obviously, with any operation. Infection can happen anytime you make an incision in the skin. And then heartburn and reflux can increase as you get older. Other long-term risks include vitamin issues, temporary hair loss, low blood count, which is called anemia, gallbladder issues, and bowel blockages still can happen. People worry about weight regain, but it's actually very rare, and we can deal with it as long as we are involved in your care. Unplanned pregnancies can also happen.
So I think there are a lot of psychological barriers to making the decision to go ahead with surgery. Probably one of the big ones is the myth that if you just had willpower and could diet and exercise, you'd be able to do this by yourself. So somehow you're some kind of a failure if you're not able to do that. You know, the reality is that less than 1%, really a tenth of a 10% of the patients are able to do that with diet and exercise.
Many people ask us who can have surgery at the Bariatric Medicine Institute. The ages are between 12 and 82. The weight is a body mass index, usually over a BMI of 30. However, if you have diabetes, will go even lower. And insurance coverages usually still require a BMI greater than 35. We do operate on people who've had previous operations before, and we are known as a center of excellence for revisional surgery all around the West. Most people, if they choose to have weight loss surgery, use insurance. However, if they choose to use a self-pay option, we have options at our office that run between $8,000 to $16,000 depending on the surgery. If the patient chooses to have it at the hospital, it will be more than that.
Planning for surgery usually takes between 1 and 6 months. A lot of that depends on your health and getting things ready. Getting ready for surgery also requires making sure that we have your insurance company ready to pay for your operation, and that can take extra time. We do like to hear from your primary care provider that all of our issues are being covered and understood before surgery.
The biggest one that springs to mind was a patient who came in there who wasn't very big, had a BMI of 30, but they'd been on an insulin pump for over 20 years. And we did a duodenal switch on this patient, and within 2 months, that patient was off all their insulin, all their diabetic medications, and was leading a normal, healthy life without any insulin.
I remember one patient who, before surgery, had problems with pulmonary hypertension and had to carry her oxygen around and wasn't even able to go up to Park City because it was too high elevation for her. After surgery, she lost weight, she got off many of her medications, and she no longer had to carry around her oxygen because of the improvements that she had in her heart and lung function after surgery.
One of my most memorable patients with duodenal switch is special because she was told at age 69 that she couldn't have surgery. And then when we did her surgery at age 74, it was like a miracle. She now has life to look forward to instead of feeling like life has passed her by. She now feels like she's going to be able to keep her diabetes at bay and go and live her life on her terms.
The next step after coming into the office is to put your health information in our web portal, Come see our doctor, write down the questions that you have about weight loss surgery, and bring them with you to the consult with the doctor and our team. Don't let the insurance questions stop you from coming in. We have insurance specialists that can help you get those questions answered.
Many people are afraid that they're going to have to become perfect. I call it being a marathoning vegan. You do not have to change your whole life, but you do need to make some changes. Most of our patients stay away from refined carbohydrates and simple sugar-type foods. They avoid drinking calories in their beverages, and most people need to get regular moderate exercise, partially for their appetite control as much as anything. We understand that regular moderate exercise is a challenge for many people, but we will help you get to that goal. Thank you so much for your time today. I hope this was helpful. If you have any questions or concerns, please contact us directly.